Hi friends, prostatitis. Inflammation of the prostate. Complaints occur in 25% of men. 10% of men have signs of prostatitis that affect the quality of life. Another amazing fact: the Americans published a study in which they simply took people who died suddenly from random causes, for example in car accident, and it turned out that in men at autopsy signs of prostatitis occur in 86% of people. However, they had no complaints. It turns out that inflammation of the prostate gland in men is a common phenomenon. There are four types of prostatitis. The first type is asymptomatic. It can be found at an autopsy or, for example, in a person who has come to the doctor about infertility. The second type of prostatitis is acute bacterial prostatitis. Occur very rarely. There is an acute disease caused by bacteria. It is manifested by high temperature, intense pain in the pelvic area, above the pubis, in the perineum, always treated in the hospital with intravenous antibiotics. Causes: first, complication of severe purulent inflammation of the urinary tract. Second, some variants of anal sex when the active partner becomes infected from the passive partner. Third, complication of catheterization or surgical procedure, successfully treated with antibiotics. Chronic bacterial prostatitis. Moderate symptoms which in some situations resemble those of prostate adenoma, problems with urination, painful intermittent urination, discomfort in the abdomen, perineum, lower back, painful ejaculation and erection. Causes: congenital or acquired anatomical or physiological features of the urinary tract, infections associated with immunodeficiency, autoimmune disease, tuberculosis prostatis as a complication or manifestation of kidney tuberculosis, ureaplasma and trichomonas, often sexually transmitted. Acute and chronic bacterial prostatitis occur in 2 to 5% of all cases of prostatitis. This is a very rare occurrence. That is, in 95–98% of prostatitis has nothing to do with infection. Oddly enough, and it goes against the conventional wisdom, prostatitis is not a sexually transmitted disease. Chronic non-bacterial prostatitis is about 95% of cases, synonymous with chronic pelvic pain syndrome. Symptoms: pain in the perineum, testicles, pain in the penis, pubis. Pain excites more than problems with urination, in contrast to prostate adenoma. 25% of people with chronic prostatitis have chronic bowel disease. Very often the causes are in the bladder or the vas deferens. When we talk about prostate adenoma, Adenoma is most often found in older people. Prostatitis is most common in young and middle-aged men. Causes past urinary tract infection. A risk factor is any bladder catheterization. Diagnosis: exclusion of other diseases. Bladder cancer, prostate cancer, paraproctitis, inflammation of the urinary tract, kidneys, and so on. Treatment. First, antibiotics help with chronic non-bacterial prostatitis. Although bacteria is a cause has not been recognized. Long courses, at least 6-12 weeks, are used. Some antibiotics accumulate in sufficient concentration in the tissues of the prostate, so antibiotics are used. Fluoroquinolone, ceftriaxone, doxycycline. Second, drugs that reduce the tone of the bladder. Third, non-steroidal anti-inflammatory drugs. Ibuprofen, in some cases effective in the form of suppositories. Fourth, antidepressants. Mental disorders due to stress are not uncommon. Fifth, prostate massage. 6. Warm bath. 7. Regular urination and ejaculation. 8. Drink plenty of fluids. Risk factors. First, bladder catheterization. Second, lifting weights with a full bladder. Third, prolonged sitting in combination with vibration. A vulnerable category of patients, drivers. Fourth, cycling. Better to use separate saddles. Fifth, delayed urination. 6. Reduced frequency of ejaculation. 7th, decreased physical activity. 8. Poor hygiene. 9. Obesity. 10. Emotional stress. 11. Alcohol, caffeine, spicy food. There is no direct connection between prostatitis and impotence. The connection between prostatitis and urinary tract infections is a myth. Good health, soon you and bye-bye.